Hey everybody, Karen Anderson here with today's weekend review. It's a very light weekend review because of the holiday last week. So I'm going to have a couple fun things to tell you about for filler. That'll be fun and exciting. But before we get started, I want you to click like, click subscribe, click that little bell so you're notified every time we go live. Like for tomorrow night on the 3rd when we have Dr. Pedro Catarino. He is joining us. Fingers crossed. These doctors have been getting very busy and we've had a few cancellations because, they have to save the world. So I have no ill will or ill feelings about it, obviously. So I'm hoping he's able to join us. He is a cardiothoracic surgeon. I believe he's leading the aortic team over there at Cedars-Sinai. So we're so excited to have him. He'll be joining us tomorrow evening. We're going to talk about a lot of different things, actually. So come with your questions. Come with anything that you have to ask related to aortic disease, and he'll be sure to give you an answer live right here on this YouTube channel, which is why I'm telling you to click the subscribe and click the little bells, and you don't have to remember, you'll be notified. All right, so weekend review. We go over some of the posts from the week prior. Again, little light week last week, but we're going to chat about it anyway, so hopefully you just give me a little chat below and let me know that you're here checking us out. Let's get started. So obviously there wasn't a Monday post because it was the holiday, and I hope you guys all had a wonderful Memorial Day and did something lovely with friends or family, or took care of whatever it is you needed to take care of if you had the day off, um, and honored it appropriately. So that was Monday. Do you know what happened on our topic Tuesday? I think people were still out for the holiday, but what's really super important is we want to take a moment and welcome our latest medical student. We call him Ani because I wasn't sure that I would not butcher his first name. So it's Ani Carla. Okay. He is our social media administrator medical student. I'm going to tell you a little bit about him right now. He's helping us with our Monday and Tuesday medically related posts. And he says his name is Ani. He'll tell you one day how to pronounce his name. I'm not going to go there. He's a third-year medical student at Baylor College of Medicine in Houston, Texas. He's an aspiring cardiothoracic surgeon with a specific interest in disease processes that are affecting the valves of the heart and the aorta. He's so grateful and excited to join the Aortic Hope team and hopes to help share the experiences and knowledge of the people in this wonderful community far and wide as he progresses through his medical career. So we are so excited to have Ani, and he's going to begin doing his post during the month of June, which I believe is going to be focused around hypo and hypertension. So welcome, Ani. We're so excited to have you. Okie dokie, everybody. We're going to jump right forward
Welcome,
to the
Ani, and
yeah,
say hello to Christina and Velda and
Hey,
Molly.
Christina. Hey, Velda. Hey, Molly. It's like Charlie's Angels. That's what I got right now. I do. Don't ask me to tell you what their names were. I only remember the person that I played as a child growing up. And my sister was Bosley because that's what a horrible older sister I was. And you probably don't know what I'm talking about, Josh, because you're too young, right? Yes.
There was the whole Charlie's Angels that came to the big screen.
Yeah, but it was very different than when it
And
was
I
on
couldn't
TV.
tell you what their names were in that either.
Yeah, I can't remember. Um, there was one back in the day of the 70s who, Farrah Fawcett, everybody loved her, right? With her feathery blonde hair. And then there was Jacqueline Smith, and she had brown, feathery, bouncy hair. And then there was, oh God, I can never remember the name of the other lady, but she had very short brown hair. So I always wanted to be Jacqueline Smith. That was going to be my character. And then my sister's like, can I be somebody? I'm like, you can be Bosley. You are seen and never, I mean, you are heard and never seen. So she'd sit upstairs and give us directions out the window as if, she was talking into a box, an intercom box. So
The best.
I'm horrible. I'm a horrible, horrible sister. All right, let's talk about our genetics. This is part 5 of what is still an 8-week series. And so far in the prior posts, we've explored a lot of the genetic conditions and syndromes like Marfan syndrome. We've talked about Loeys-Dietz. We've talked about Ehlers-Danlos, specifically focusing on vascular Ehlers-Danlos. Each of these can really increase the risk of having a thoracic aortic aneurysm and a dissection. So the interesting thing is that of the aortic disease world, 30% or so of that population has a connective tissue disorder. Known, they know what it is. And the rest of us, the 70%, we don't know just yet the reason why this may have happened. And I say just yet because new genes and mutations are being discovered all the time, and which is why we encourage people who are having genetic tests to do it like every 6 or 7 years. But of the 30%, at least 50% can have dissections and do. So they're at a much higher risk to have an aneurysm or dissection than the people in the 70% population. So, pros and cons, we can't look at everything as being a con. It's always a pro to know that you have something so that you're, appropriately monitored. But just want you to think about that a little bit. So the people that know they have a CTD are at a higher risk for potentially having an aneurysm or a dissection. And this past week, we really wanted to focus on something different, and it's called a non-syndromic hereditary thoracic aortic disease. So this is a condition that runs silently in families without the obvious outward signs of a connective tissue disorder. Like we talked about people that would that have flexibility or have long limbs. These people, they don't. They don't have anything traditionally that visually you can say, oh, I bet that person has Marfan's. So they don't have the longer limbs and they don't have the over flexible joints, and there aren't any vision issues, just a hidden genetic risk with potentially life altering complications and consequences. This form of HTAD is often diagnosed, and that's because it doesn't really come with any visual clues, which is what we've been talking about. So in many families, it only comes to light after someone has a dissection or is diagnosed with an aneurysm. And understanding how it's inherited and how it's diagnosed and what you can do about it, that really can be life-saving for people. So let's get into this. All right. If you have not checked out the prior blogs, I suggest you do so, and just it'll help you with the basis and the groundwork of understanding what genetic conditions are actually all about anyway, right? It's not necessary, but the first post in the series really helped lay out the explanations for this discussion. So you want to check it out. And again, as always, if you have any questions, feel free to email ryan@myaorticjourney.com. Ryan Rodimer is our genetic educator, okay? And he'll be more than happy to answer questions for you. So let's get into it. What actually is HTAD, or non-syndromic hereditary thoracic aortic disease? What we know is it's a mouthful, okay? It's a mouthful, but it's really important that we understand this. Like all of the syndromes that we've already discussed, non-syndromic HTAD is also a type of aortic disease that actually affects the thoracic aorta. It's obviously the large blood vessel that carries the blood to your heart and to the rest of your body. We talk about this all the time. You might also see this be called hereditary thoracic aortic aneurysm and dissection, or HTAAD. Unlike syndromic conditions, however, non-syndromic HTAD doesn't come with the additional symptoms that we've talked about, like tall stature, or we already talked about, it doesn't come with hypermobility. It doesn't come with vision issues. However, it is inherited in the same manner as Marfan syndrome would be, or vascular Ehlers-Danlos syndrome, which we are going to talk about in just a minute. So although relatively rare, non-syndromic HTAD is an important condition really that you need to understand, because it can lead to life-threatening complications such as an aortic dissection and a rupture. And just like syndromic genetic conditions previously discussed, non-syndromic HTAD is caused by changes or mutations in certain genes. And just like syndromic conditions, the non-syndromic HTAD, it's typically inherited in an autosomal dominant manner, which means you only need to inherit one copy of the mutated gene from one parent to have this condition. It is passed down in a 50-50% manner. It also could occur as the result of a new genetic mutation, just like we discussed for other conditions. So it could be something that is relatively brand new. Some of the common genes that you might hear associated with non-syndromic HTAD include ACTA2, which was only recently discovered, and I say recently because I think it was less than 30 years, MYH11, MYLK, and PRKG1. These all sound a little foreign to the majority of us, but to the individuals who have been diagnosed, it is not foreign at all. Interestingly, these mutations in genes that we've already discussed that are known to syndromes, they are now known to be capable of causing non-syndromic aortic disease as well. So listen to all these letters: TGFBR1, TGFBR2, SMAD3, B2, and FBN1. And I do know that I believe FBN1 is a filibrin 1. So I feel like I've heard some of these terms before in many discussions that have been led by other geneticists. Genetic testing and increased awareness are presenting us with so much new knowledge now, more in just the 10 years that I've been in this community. And there's still so much that we have to figure out, but there's constant progress that's being made. And I would think that even in the 2 years since we initially presented this, we're probably getting very close to needing to update this already because it's just an ever moving process. Those who meet the criteria that we're going to talk about below or in a few minutes, diagnostically wise, they may need to temper your expectations when it comes to genetic testing. It's great when we can find the genetic mutation responsible, right? We kind of feel the sigh of relief because now what we know what to look for in our children, and it kind of gives us insight on how to manage the disease from imaging or surveillance, how frequent to do it, to when one should consider possibly having surgery and being proactive to prevent a dissection, maybe even helping to identify which family members might have inherited the risk and which have not. However, in HTAD, the chance of finding the actual mutation is still very, very low, like 20%. And that might not sound low, but it kind of is. It's pretty low when you talk about it. It's because we haven't discovered all of the genetic causes just yet. So just because a genetic testing is negative, which we talk about all the time, it doesn't mean you didn't have a genetic reason. It just means just not known today. There was a really helpful article on the John Ritter research. I think it might be on the John Ritter Foundation for Aortic Health or Aortic and Vascular Health. It might also be on the John Ritter Research Program, which is specific for the genetic testing, but you can go try to check that specific article out. So non-syndromic HTAG can be difficult to detect because it often, as we know, doesn't come with any symptoms or complications, or at least not until the complications actually arise. And that just makes things very challenging. We don't have clues on the outside of our bodies that would point to a possible problem that could be happening on the inside. There aren't certain characteristics that could be spotted by a knowledgeable physician. So our biggest tool is family history. That's why we talk about think aorta, think family. That's why we want you guys as often as you can to have these conversations and know as much as you can about your family medical history for situations like this, where we can't visually see what's going on, but knowing that history might help us want to just delve a little bit further. For Ryan, he was very fortunate that his aneurysm was incidentally found as a result of completely unrelated heart infection, totally unrelated to all of this. No known family history. He was the proband, which means the first family member that was identified with having something. So without having a known family history and a known prior knowledge of his aneurysm, he might have handled the pain that he was in when he experienced a dissection completely differently. He might have decided to just wait out the pain, as opposed to calling 911 and advocating for himself immediately. So that's kind of the important part of having the genetic testing, of understanding your family medical history, because you can become armed with knowledge. And so knowing that you have something, right? And you feel that kind of pain and you know in your gut something's just not right, you know what you might potentially have, so you make the phone call. But if you don't know, a lot of us think it's just really bad reflux. We just think we ate something bad or we pulled a muscle. So knowledge is power, especially in the cases of genetic testing and understanding your genetics. So it took a while for Ryan to get his family members checked, and they finally decided to take the risk seriously once he had his dissection. So it sounds like they didn't get checked prior to, but once he had the dissection, they knew this is very important and we need to know if we have something too. But now he knows that his father and his two sisters, they also have aortic disease. So in his case, even though there was a family history, nobody came to the medical attention except for him. And it was all by accident. So without this, nobody would have known anything, is what's crazy. So non-syndromic HTAG can be very, very tricky. And unfortunately, the first clue of its presence is usually a dissection. So as Ryan says, we don't need to spend a lot of time here because it's covered in great detail elsewhere. But what is it like to dissect? Some people might experience pain in their chest, neck, or their back. Usually it's sudden and it can be extreme, often described very differently than a heart attack pain. Some describe it as being tearing or ripping. Ryan's was more blunt, constant pressure. Mine felt like I had a gas bubble pop and that I had acid reflux. I really wasn't in pain. I know some people that just felt off and had a dizzy spell. They didn't have any pain at all. Again, why it's important to have knowledge if you can, even if it's just a family medical history and you haven't been diagnosed, when you feel something that's really off. And I want to believe, and I think I'm going to do a poll, that most people who have had a dissection would say it was something that they just knew was different than anything else they've experienced before, whether it's mild, barely existent, or the most horrific pain they've ever felt. You just kind of you just kind of know this is probably bad and we need to be checked out. Sometimes people have shortness of breath. And to diagnose non-syndromic HTAD, doctors typically use imaging techniques like the CT scans or an MRI or an echo and combine that with the family history and information. They'll also add in genetic testing, but not everybody with thoracic aortic disease meets the criteria for HTAD. But as previously mentioned, when the aortic root, that area that connects the aorta to the heart, or the ascending are enlarged, it's largely thought to have at least some type of genetic cause or influence, even if genetic testing can't find the culprit. And that's where surveillance for family members via echocardiogram, CT, or MRI, that's where it comes into play. So whenever I read on the pages, people saying, I have no family member, I have no history, nobody knows what happened to me, it was just a spontaneous weird thing. I'm just, no, not if it was your root and your ascending. It's more than likely not just some spontaneous weird thing with no answer anomaly, would just live my life with the head in the sand. No, this is where sometimes digging and finding out that your grandfather passed suddenly and they told you it was a massive heart attack, but nobody did an autopsy, that information is very, very helpful because it probably wasn't a heart attack. If there's no autopsy to rule it in, then it could be ruling it out. And as we've heard before, if you can't connect the issues, think connective tissues. So it's just little things you have to try to remember. But diagnosing criteria for HTAD, given the importance for early detection for at-risk families, it's really crucial to understand the diagnostic criteria for hereditary thoracic aortic aneurysm and dissection. So, a thoracic aortic aneurysm or dissection, in addition to the following: the absence of other syndromic features as seen in Marfan syndrome, Loeys-Dietz, or Ehlers-Danlos. Uh, Without family history, an HTAD is highly suspected. You have to, because we just don't know. When a thoracic aortic aneurysm or dissection is present at less than 60 years of age. Once you're over 60, there's sometimes some other more obvious reasons why this could happen. So when it comes to risk factors and complications, so the main risk factor is obvious: family history and genetics. We just talked about this ad nauseum, right? However, just as for an aortic aneurysm in general, there's several factors that can increase the risk of developing a thoracic aortic disease, which should 100% be avoided in those with a genetic predisposition or family history of aortic disease. And this is what it would include: hypertension. We don't want hypertension or high blood pressure. And smoking. Smoking will always be listed as something to avoid when it comes to aortic disease. It's always going to be there. Now, when it comes to treatment and management, treatment for non-syndromic HTAD focuses on managing risk factors and preventing complications. So obviously we have to maintain a good sense of blood pressure control. Keeping the blood pressure in check is really going to be crucial. Reducing your stress, reducing the stress on the aortic wall, and preventing a dissection. when it comes to medications. Doctors could prescribe a beta blocker or other medications to help manage blood pressure and reduce the risk of a complication. Now, when it comes to surgical intervention, if it becomes time that we have to do that because an aneurysm has hit that the number that's critical for that person, or if there's been a dissection, surgery might be necessary to repair or replace the affected part of the aorta. So here's the indications for surgery if you have a rapidly expanding aortic aneurysm, and we have talked about this before. What does growth mean? Growth means 3 millimeters or more in 1 year. 3 millimeters or more. So if you had a scan that said you had 4.6 and now you have one that says it's 4.7, that's not growth. It's probably an anomaly. It's probably a heartbeat. It's probably somebody else that read the test. You have to assume all these other things could possibly be an error. Growth is going to be 3 millimeters or more. Surgery also could be indicated if there's a high risk of aortic dissection or a rupture based on the gene mutation or the size of the aneurysm. So there's different types of surgeries, and one would be an aortic root replacement and valve sparing aortic root replacement. And what is valve sparing? So that means we're not replacing the valve with something mechanical or tissue. It means we're sparing. We're letting you keep your valve and maybe just tightening up a little bit, doing a little, not nip and tuck, a little, you know, revising and enhancing your natural tissue. It's kind of what valve sparing is. But your doctor's going to talk to you about what your different options are based on your individual circumstances and lifestyles and choices. Lifestyle leads us to lifestyle modification. The things I know a lot of people hate to hear about. Look, regular exercise is going to be across the board with any type of disease element that anybody might have. Staying active can help somebody maintain a healthy weight and also help you manage your blood pressure. Healthy diet. Nobody seems to understand what that means. I know a lot of people like, I don't know what's that mean? Low salt, no salt? Well, of course. It's just a balanced diet, right? That's going to help manage your blood pressure and your overall health. So I think it's pretty obvious the things you might want to stay away from, like the fried foods and right. And other things, if you, me personally, I'm like, if I just have something bad once in a blue moon, it's not gonna be that bad. But you have to make that decision with your physician. It's really going to be between you and your doctor as to how strict you have to be with your diet. But I know so many people in this community, if they have a dissection, they go hog wild crazy. I'm not eating again. I'm going on a, I'm going to fast all day for, and not eat, or I'm going to just, I'm changing everything. No, you're not going to change everything. It's never going to stick. You have to come up with a plan that's going to be something that you can actually do. So you start small. You start small with your changes and work with your physician. And maybe your insurance even has coverage for a dietitian or a nutritionist, right? Just look into some of that. But stress management's also very, very important. Trying to reduce your stress will help you control the blood pressure, and it's going to lower the risk of aortic complications. And that's something that's also in your control. Actually, you can join one of the Qigong live events that we have on Sundays at 12:30, led by a community member who had a dissection. It's very relaxing. It's slow, easy movements. Of course, if you feel more comfortable clearing it with your physician, then do so. But that's a form of mindfulness and stress reduction. There's a lot of things out there that you can check out and see what makes you most comfortable. Now, prognosis and prevention. So, with early detection and appropriate management, the long term outlook for non syndromic HTAD patients can be very positive. And preventive measures for at risk individuals include the following: genetic counseling and testing. It's important. This can really help determine your risk of inheriting a non syndromic HTAD and provide medical management. Regular checkups are very important. Regular surveillance via imaging. So, whether it's staying on top of your health with routine checkups, having your screenings, it's really going to help catch any issues early. And that's the key: early detection and prevention. And monitoring for symptoms. So, be vigilant. Be vigilant. Is that the word? Yes, that's the word I want to say. Sounds funny. Be vigilant with any signs or symptoms of non syndromic HTAD and report them to your doctor promptly. So, in conclusion, all the things we just talked about: non-syndromic hereditary thoracic aortic disease, HTAD, is a complex condition. It requires comprehensive understanding of the genetic basis, the diagnostic criteria, and the management strategies. And by staying informed and proactive in your care, you can really help prevent complications and improve your overall quality of life. And remember, you're not alone on this journey. Reach out to others that might be in a similar situation, share your experiences. We have 3 different support group meetings that happen in the course of a month where you can talk to other individuals and share your experiences and learn their best practices from a stress perspective, a diet perspective, exercise perspective. This is all tools for you to take back to your physician and ask questions. You can get information about our support groups by just simply clicking our events page. We'll get to that shortly and you'll see all of them listed. But sharing these experiences and talking about it, it really helps to continue to raise awareness about non-syndromic HTAD. And together we can really support each other and make a huge difference. And again, if you have any questions or concerns about this or about any of the connective tissue disorders and syndromes we've been discussing, or maybe something that you've been diagnosed with, feel free to email Ryan at myaorticjourney.com. And as always, let's just continue learning from each other and supporting each other on this journey. And don't forget, think aorta, think family. That's a lot, but good stuff. Love Ryan's stuff.
Do you
About your
remember the
genetic
movie
series.
Old School?
Yes, who's in that again? That's the and the other one, the 2 guys,
And
right?
then they go and they do this like debate. And homie's
Okay.
like, I blacked out. What happened? What happened? And he wins the debate. And I thought of that as you were closing this out. I was like, she doesn't remember the beginning of this article.
No clue.
It was like 20 minutes ago.
But I read through it all
You did. You
in a
did an
very
amazing job.
conversational
It was
tone.
very good. You always
Yeah.
do very good.
No, as it's scrolling, I have to dump in order to put more back in. It's the only way it works now.
Because my favorite is we're not gonna have a very long show today. Okay,
Yeah,
we're
we're almost done.
we're 26 minutes in. This was
Okay.
Tuesday.
Oh, well, there you go.
Dan
Anybody
joins
else
the
have anything
chat.
they want to say? Any of my Charlie's Angels?
Well, Dan joins the chat and he says my
Hey,
medical
Jen.
team said my aneurysm likely came from lifting cars and several
Mm-hmm.
foolish attempts to lift a bus. And
Yeah.
if you guys
Okay.
don't know what Dan looks like, just picture a Viking,
Yeah.
okay,
Okay.
and then make him a little bigger, and you're getting on the right road.
There you go. Yeah, no, that can do it. Absolutely. Those are spikes, serious spikes in blood pressure. And that's why even family members of people who have had a dissection, regardless of genetic testing results, if they've happened or haven't happened, they tell the kids, don't deadlift, heavy lift, lower weights, higher reps. It's very hard to tell a 15-year-old male child, don't go to weightlifting class and do what everybody else is doing, and it's just because that vasovagal effect of that pushing that blood flow through and, turning red in the face. That's so not good for your system. So I look at a lot of these people that do a lot of sports and activities that involve that, and I get scared. I'm like, what does that aorta look like? Like, do they even know? Does anybody even think to tell them, let's check it out, right? Scares me. That's why a lot of women have dissections in childbirth. The bearing down, like their veins popping out, trying to push a human out.
I mean, you're saying the words a lot, and I
I
don't want to
I don't know that
say
a
a
lot.
lot. Yeah, there you go.
Yeah, no, not a lot, but it does happen. And even when you have a woman who has preeclampsia who already has a blood pressure of 211 over 170, right, going into labor, I find it fascinating that they still let that labor happen and never think to do an echo before they give birth to see if 9 months of super high consistent blood pressure didn't do any damage. I'm fascinated by that. And it's just not a thing. Nobody's made it a thing yet. So I don't know. I don't know. But I believe it could have been from that heavy lifting of buses and cars. What an interesting hobby. I'm just gonna
Hawkman.
lift a car today. All right. Let's gonna lead us into Feel Good Friday. When it was the end of May, which was like what, 72 hours ago. Um, It's the end of May and you can feel the energy shifting. I know I can because I'm super excited because it's going to be summer, even though it sometimes is not really feeling like it with the amount of rain we've had, although my lawn looks so lush. It's like a jungle. Days are starting to get longer. The air is warmer. Everything feels just a little bit brighter. And whether you're soaking up the sun or chasing your goals or simply savoring a quiet moment, this past Friday was all about celebrating progress and possibilities. So take a deep breath. I'd say do that every day, right? And smile at the little wins and let that hopeful, fresh summer feeling carry you right into the weekend or every single day. Let it carry you into one day after another. So we were just wondering what people were grateful for. We had a bunch of different answers. And I I don't even remember. I answered, but again, I just read this. I don't even remember what my answer was.
See,
I
I
don't
don't
know.
mean to make fun of you, but that's always fun.
So true though. Like, I don't know. I answered. I have no blazing idea what I said. But I do like questions like this. It makes me think. And honestly, these are little things that we haven't talked about this in a while, but there's a resource that we have, and we really haven't touched upon it. And I just want to take a minute and do that. And I think as I'm talking, I'm going to pull it up real quick. So there is a resource uh, called Help Texts. And I bring this up because I was just thinking about the whole Feel Good Friday thing. And we partnered with this organization called Help Tex. And what we decided is instead of getting any monetary kickbacks and all of that, which is fun, we said no to all of that. And we decided to allow all of you one free month of experiencing what this organization has to offer and deciding on your own if you feel it's worth spending the $70 or so for a year subscription. And if not, you move on. And unlike most subscriptions that you have to pay up front and then remember to cancel, you pay nothing. They don't want credit card information. They don't want anything. They just want to get your cell phone number so they can text you something. That's it. There is no financial obligation, commitment, nothing. If you like it and you felt it worthwhile, then you would fill out all that information. So here's what it does. It provides a very interesting form of support through affirmations and self reflection questions. Now, there's a couple different buckets. You can click that. The reason you're utilizing them is because you've suffered a major health trauma or change. I believe there's a grief bucket. There could be a grief over a pet. Um, there's also a caregiver bucket. And you click on what it is you're looking to feel supported. It is not therapy. It is truly just support from a mental health well-being perspective. Um, and it takes less than 5 minutes to sign up, and your texts literally begin right away. And what it gives you is 2 texts a week at a minimum during that course of that month. In that month, if you hit a milestone, an aortiversary, an anniversary of a loved one's death or your wedding or whatever, a milestone, they'll give you an extra text. In addition, you can designate 2 friends or family members that they can receive a text as your support system to learn how to best be supportive of you. So these texts, they're very interesting. When I first signed up, I was like, what kind of like silliness am I going to be getting? And the next day, the first text was something like, if you wake up tomorrow morning, what's one amazing thing you can tell yourself to start your day? And I was like, this is so dumb. I don't want to think about it. This is dumb. And that's all I thought about. I was like, well, what would I tell myself? And next thing you know, I was like, okay. This text got me thinking. That's interesting. And I didn't think about it for a couple more days. And then the next text came, and it was another one. It was very validating on things that I feel. And then it asked me another question, a probing, thoughtful question, kind of like, what are you grateful for? This past Feel Good Friday. I was like, this is so dumb. And then again, I was like spellbound and trying to come up with an answer. And then I realized, okay, these things kind of are working because I'm actually decompressing. I'm not feeling stressed. And I'm really spending a lot of time thinking of positive things I want to say to myself, which we don't do enough of that ever. And it felt great. And so at the end of the month, I see a lot of value in this. And I do challenge as many of you sign up. It's free, for goodness sakes. I want to know your thoughts. Is this a worthwhile thing we should continue to present to the community? Just because I think so doesn't mean it is. I want you guys to sign up. I know we have a couple of our volunteers are now signing up, specifically ones that are therapists, and they're going to give me their point of view. And if they like it, they may join the team of helping to create the texts that go out to people, especially that have an aortic disease or issues like that. It might actually expand into something very specific. So sign up, see what you think, see if it doesn't help lift your spirits or um, decompress your stress. I'm curious to know what you think when you get those first few texts, but you're going to get on average about 8 to 10, maybe 12 in a month, depending on how many weeks there are. But again, it's free. So the support that you're getting is a gift from us and from help texts. Okay. And I really hope that you find it helpful. So when you get a chance, check it out. It's under resources. Just go down and look for help texts.
Good job.
Oh, thanks. Just popped into my head. All right. Survivor Series. So this past Saturday, we brought you a really incredible, very moving, almost trigger warning Survivor series from our own volunteer who helps with our Wacky Wednesdays post, but she's also on the board of Think Aorta US, handling all of the social media over there. And that's Sean Nicole or Sean Nicosia, depends on how you've known her in the years that you've been with the company. With the community. So I'm going to read you the story, okay? Hello, my name is Sean Nicosia, and I have the privilege of not only being a social media administrator with Aortic Hope, but also being on the board of Think Aorta US as their social media director. And this is my survivor story. My story starts when I was 12 years old. I was diagnosed with an autoimmune autoinflammatory disease called ankylosing spondylitis, or AS for short. This disease mostly affects the spine, causing it to fuse together, and it can also affect your eyes, lungs, joint, teeth, heart, and aorta. At the time I was diagnosed, we were told that it was only in the spine, joints, and that the eyes would be affected. That's when she was 12. As I grew up, I mostly only had minor aches and eye infections. So AS wasn't a big thing to me. I was never even put on meds to treat it. Then, when I was 35 and 8 months pregnant, my whole world changed. I got up that morning, got dressed, then was going to put my hair up. And when I raised my arms, I felt the worst pain I have ever experienced, ever. Like someone stabbed me in the neck and was dragging the knife down my back. I didn't know what was going to happen, what was going on, but I had the feeling I was going to die. I yelled for my son, Shane, to call an ambulance. After about 10 minutes in the ambulance, Oh, I'm sorry. After about 10 minutes, the ambulance nor the fire department was here yet. 10 minutes. Nobody was there. Now, there's a fire station directly across the street from me. So Shane got mad and he ran over there and started banging on the door. Soon after, they showed up and the ambulance right after. So I'm finally on the way to the hospital, and that's when I heard them calling the hospital, talking to them about me, and it wasn't nice. I told them about how bad the pain was, and they were asking if I did something to hurt it. Did I fall? Was I in an accident lately? And the answer was no to all of it. Basically, they thought I was overreacting. I get down to the ER and I'm begging for anyone to help me. The nurses told me to calm down and I would have to wait my turn and they wouldn't be getting pain meds because I was pregnant. They thought I was a drug seeker. Finally, they came and told me they couldn't see me because I was pregnant, too far along in my pregnancy. So they sent me to labor and delivery. So I get there and I'm getting worse. They spent way too much time trying to get the baby's heartbeat. I kept telling them that the baby was okay, that she was very active at the moment. I asked them to please help me. Something isn't right. No one believed me. The last thing I remember was shooting straight up in bed. It was hitting my chest in a panic and saying, I can't breathe. I then fell back and went into cardiac arrest. My son ran to the nurse's station and told them what happened. He then made he then wait, sorry. He then was made to stay in the hall and he hears them call code blue. It took that happening for anyone to believe me. So I see I'm getting fired up. That's why I'm messing up my words because it just it all fires me up. Ageism fires me up. Sexism fires me up. Just people automatically thinking someone's a drug seeker. It's all aggravating. So she goes on to say, I was rushed to the OR for an emergency C-section. When I was being prepped for surgery, a cardiologist was doing an echo and looking at the heart. At the last minute, he stopped them and told them that if they took the baby, then we would both die. From there, I was transferred to a better, more equipped hospital. I went straight into surgery, emergency open heart surgery, and a C section simultaneously. And as they were cracking me open, my aorta actually ruptured. My family was told not to expect either of us to survive. My baby girl lost blood supply and they couldn't get her out fast enough, and she died. I made it through, but even after the surgery, the family was told I only had a slim chance of surviving. There were a bunch of complications, organs trying to shut down, strokes, etc. I was on life support for a month. The thing that just kills me is that I never got to see my baby girl, didn't get to hold her, kiss her, smell her, or tell her goodbye. I got nothing. In my eyes, that is what was tragic, not what I was going through physically. Children aren't supposed to die before their parents. It's just not fair. For me, this experience didn't have a happy ending. Yes, I was saved, and I'm grateful for that, but not a good outcome. I am now doing whatever I can to make people more aware of this complication with ankylosing spondylitis and also to help with aortic awareness in general, and I will continue for as long as I possibly can. On that note, on certain Saturdays during the month, we share stories from survivors or caregivers within the aortic community. Even those who have lost loved ones, we're interested in that story as well. So we're asking you to consider being the shining star in someone's life. Submit your story of survival. Uh, we want to know the symptoms. We want to know how you were treated. We use all of this as an educational tool in Think Aorta US to help educate the emergency room physicians, to help them to stop and think about the aorta. When you share your story, you are validating somebody else's story. And it's very therapeutic for the storyteller as well. And you have 3 different ways you can do this. You can submit it in written form, as Sean has done here. You can sign up to do a pre-recorded video that will be shown on YouTube. And you can also choose to go live like I am now, and then you can take questions from the community. Whatever way you do it, we just hope you do it because these stories are important. They're an important tool in providing a therapeutic experience for those of us listening and an educational one, not only for the community, but for the physicians as well. So consider being part of our Survivor series. Ugh, it's a tough story. All right. Share with us Sunday at Aortic Hope.
Well, let's take a beat on that, shall we?
I can't. It's so much sadness.
It is. And she lived, right?
And Sean's doing amazing things. You know, she found her role. She found a purpose. And, you know, ankylosing spondylitis, people with Crohn's disease can have AS. It's not necessary that people with AS has Crohn's. So it's all in this inflammatory disease area, which I know there's a couple people in the community with Crohn's disease that have had a dissection. And then it makes you think, if your heart is working so hard because of an inflammatory response to a disease like AS or rheumatoid arthritis or RA or Crohn's or colitis or what have you, lupus is another big one, right? The heart's working so hard, that could also in and of itself contribute to an aneurysm because it's trying to push those inflammation markers down. But we don't know any of this when we're going through it. You only learn this stuff after you come out on the other end, which is so kind of sort of frustrating. I wish that this would be part of the education of learning when you have Crohn's or RA or lupus or AS or whatever the case may be. So Sean's really making great strides in the AS community. And because of the work she's been doing, I've been kind of gingerly stepping around the Crohn's and colitis community, just every now and then giving them I would maybe consider just having a baseline test with the cardiologist, especially if you've had inflammation markers that are normally supposed to be 4 and below, and you're running in the 30s like I did. It's, you know, over time, it can do a number on your system. So hats off to Sean. She has survived. And it's, you know, a loss never leaves you. It's like a shadow always with you. But she's decided to take that loss and really move forward and do some amazing things in the community. So,
I just wish she wasn't so shy.
She is shy.
She's very shy.
But when you get to know her,
I bet you she's a riot. I bet you she's a riot.
She is a trip. She's the one that, I mean, messed me up in New Orleans. You know, she's like, here, drink a Hurricane. It's so fruity. And I sucked it down. I'm like, was there alcohol in it? And she's like, wait, it's already gone? I'm like, yeah. She goes, oh, God. And then I paid for it severely. It hit me like a wall. She has video proof of that. stuff that I do not remember. A lot of singing, a lot, I don't know. She's very funny, and she will sing. She's done some really fun stuff with us with the girls when we're out, and she knows you and she's comfortable. Girl, it's crazy. She is crazy fun.
That's
Yeah.
hilarious. Dan
Yeah.
says, I went through the whole he's just trying to get drugs thing too, and he got enraged.
Yeah. It's horrible.
Anecdotally,
Yeah.
when I had emergency gallbladder surgery,
Hmm.
that was a thing they did to me, and I was rocking back and forth, sweating from how much pain I was in, and they were just like, "And what drugs are you on?" And I'm like, "Drugs? It's 6 o'clock in the morning." Like,
That doesn't happen until 4:20. You should know your
it's
time.
like, who's doing drugs at 6 o'clock in the morning? That's how
Yeah, that's
naive
always
I
been my
am,
fear.
you know.
That's my fear. Because when I was in the thick of things with Crohn's before the dissection, I mean, I was going in the hospital constantly. And it gets to the point where they're like, is there any medication you're allergic to? And I'd say morphine. And then I would say, but I know what works, and that's Dilaudid or fentanyl. But take your pick. I don't care because I need relief. And you hear it come out of your mouth, and you think it's going to be a day where they're going to say, why does she know so much about those two drugs? And is she pushing for drugs? But it never happened to me, thank goodness. I'm very lucky about that. But I wonder what makes them not think to ask me that question. What makes them decide to ask that question? I hope, well, it's probably a lot of stereotyping, and that's just terrible. It's terrible. Stressful, stressful, stressful week in review. Thought this was going to be simple. All right, I'm moving on. Share with us Sunday. We changed it from share with you to share with us. We want you to interact with us more. And so, um, do you like podcasts? I don't ever listen to podcasts. Like my sister loves books on
Is this
like
an
recordings.
anecdotal question? Because
I mean, I know that you do.
I
I know you
obviously
do.
do, yeah.
Yeah, I'm
But
like,
you're
no.
on
I
one right
I
now.
know I am. Like I'm just learning about Spotify and DJ Godfather. So I will play that and just go bananas. But I don't know. I mean, I'll listen to it. I guess it's a podcast on Sirius Radio. They'll do it as a podcast and have it on the radio. I just get bored. I get
Okay,
bored.
so
And or I want
there's a
uh,
culture of found time that I think you're missing. Okay.
okay.
The largest consumer of podcasts or even audiobooks are people that have jobs that require their eyes and hands, and their minds and ears are absolutely free. Right?
I don't
So
know what
like you're
that's like.
driving, like your job is to drive a truck for
Oh,
18
okay, sure.
straight hours, right? So
Sure.
you need your eyes and your hands, but your
Right.
ears and your mind are completely free,
True. Okay,
right?
that makes sense.
Now let's say you're in manufacturing, let's say you're in sorting, let's say you're
Mhm.
in delivery or what have you.
Yeah.
Like there's a whole slew of things that are out there that require literal eyes and hands, and that's your
Yeah.
job. You're putting these two things to work.
Right.
And so that's the reason why when you look at YouTube statistics, people are like, how is
Mhm.
it that, we're putting up a video and 40% of the people are watching this on their cell phones,
Mm.
right? And it's
Mhm.
like, because they're not watching
Right.
it.
They're not.
Their
They're
cell
just
phone is
listening.
connected to a Bluetooth device in their
True.
truck, in their
Right.
office, or in a headset or something, and they are
Yeah.
just chugging through work, and you are helping them get through their day.
Yeah. That's not me. I like to talk on them, I suppose, but I don't like to listen to them. I'm just being I'm a visual person. I if I have to listen or read, I like to I will listen, but I need to see things move, and that keeps my interest.
Yeah.
That's how I'm a visual learner. So, but if you do love podcasts, right? Cleveland Clinic evidently has a podcast called Love Your Heart. And their goal is to help you learn more about heart and vascular disease and conditions affecting generally your chest. And so recently their topic evidently was managing aortic aneurysms. And so we've got the link below if you get a chance to check that out. I love that Nikki found that for us. She handles this post, and I love that I love that she found that. For those of you that love podcasts, there's something you can connect to. Tell us what you think of it, because I didn't listen to it. Nope, not I, said the fly. All right, talk about our events. But I want to talk about the support groups that we were just talking about before when we were discussing the genetics post and people that find out that they're diagnosed with different things. So we changed up our events page. So it makes it very simple. You want to join any of these support group meetings? Look, we've got 3 for caregivers. We've got 3 for survivors and caregivers. So it's for anybody, including physicians. They'll show up at these sometimes. We have 1 for our friends in Canada, and we have 1 that's in Spanish. Okay. These are actual support groups. The reason we did not include WISE, which is Women Inspiring Support and Encouragement, is because it's kind of more like a free for all conversation. It's not necessarily support. It could be exchanging of information. It could be, it's a lot of things, but I don't know that it's not really structured like a typical support group. Although if you click here, you do have to register to receive a link to join that event, which is always the last Monday of the month at 7 p.m. These are all right here specifically with their dates and times. When you click on one of the highlighted areas, it takes you right to the registration form. So it's easy peasy, very easy. So let's talk about a little bit what we have coming up. Hey, you know what? Like tonight we have, I think we're still having a Spanish support group meeting. Could be
No,
happening
no, I
tonight.
don't think we have one tonight. Yeah.
Not happening tonight. Okay. But we do have our very first support group meeting of the month. Happens every Tuesday, of the first Tuesday of every month. And it is at 12 o'clock Eastern. And that is a combination originally created between Aortic Hope and Aortic Bridge, which is a nonprofit organization based out of Brooklyn, New York. Was started by Maimonides Medical Center and Dr. Ben Udelman. Also, tomorrow night at 7 p.m., we have that interview with Dr. Pedro Catarino. And then we have a Canadian support group meeting coming up Thursday, our Therapeutic Thursdays. They're really very much structured about you. We would love to have you as a guest and talk about if and how aortic disease has impacted you from a mental health or emotional perspective. It's kind of like an expanded part of a survivor story because inevitably you're going to tell a little bit of your story, but it's really to help validate people from a mental health perspective that feeling a little depressed was normal, crying easily was normal, nightmares could be normal. Just an overall change in personality and how you see the world, very normal. And it's very validating even for me 10 years later to hear people and what they talk about. So we do have a special guest, a community member named Jeremy Porter. He's going to be joining. If you'd like to join, there is a link that you can sign up and join that. We have our aortic kitchen coming up this Thursday, 6 p.m. It's on the 5th, and it's all about cheese. I don't know what they're doing with the cheese. I don't know if they're making cheese. I don't know if they're just cooking with cheese, but you're going to have to join to find out. And that'll happen twice, usually within the month. Then we have a live Survivor series happening this coming Saturday with Dee. How does she pronounce her last name? Is it Reet?
Oh, that's a good
Reet.
question.
I'm going to find out soon because I'm scheduled to talk with her because I think she has interest in volunteering with Aortic Hope. So that's exciting. And then we have changed our caregiver support group. It's now Caregiver Connection. And the reason we did that is because we don't want caregivers to feel that their meetings are all about like giving support and taking some. We didn't want it to feel heavy because I think caregivers tend to have no choice but to bounce back per se from any diagnosis or surgery or event sooner than the patient does because sometimes they have to go back to work. They are physically capable of going back to a normal life, for lack of a better term. So we want this just to be a place where they can connect and talk about really literally anything that they want, underneath the idea that if people need support, it's going to be provided. Every Sunday we have Qigong with community member Kevin Songer, as I mentioned earlier. Let's see what else we've got. Oh, we have the Aortic Artist coming up on the 17th with Diane Bishop. We are doing a paint along on a picture. I do not have any other more information, I don't have any additional information other than I know it's going to be a canvas, paints, and brushes. We'll talk about that soon enough. And yep, that's pretty much it. We are looking to do an Ask a Doctor that we didn't get to do last month. We are looking to schedule that this month. That is to be determined. And once we have that, we'll let you know when that's coming. And I can't believe, like when I look at the calendar, I just think, oh my God, June's already over, but it's only the 2nd. But this stuff goes fast when you make these calendars. It's amazing. let's see, we are less than 3 months away at this point before it will be Aortic Disease Awareness Month. Like, that's crazy to me. That's crazy. So a lot of really exciting things are getting ready to happen over the second half of this year, and we're excited that you're here with us. So shout out to everybody that joined me today. Thanks, Dan. Thanks to Molly and Christina and Velda. And did I miss one other person? Oh yeah, let's hear the
Yeah, we have
chat.
some extra chat here.
Mm-hmm.
Let's see here. So Dan says, I offer Aortic Hope the use of my advanced text to AI voice. I think he might have modeled his voice. That might be interesting.
Ooh, could follow up on that.
We're not doing support groups in WhatsApp or anything, right?
Mm-mm.
Yeah, that's a negative there, Dan. Um, Molly chimes in here. They must have a huge reason to suspect every single person coming in the ER because they're seeking drugs. I was
Yeah.
asked 3 days after my release from the hospital in one of my ER visits. He was suspect of me. There had been a cyber attack on the hospital, so no records were available, and he didn't know my history. Thank goodness
Mm,
an ER nurse recognized me and
yeah.
vouched.
Wow.
Right? Uh,
That's just crazy.
Dan says, I think DEA and hospital admin give too much info to medical staff about suspecting drug abuse. So
Yeah.
staff is just acting according to their training. He might be onto
Yeah.
something.
Mm-hmm.
This is one of those easy out things for risk management.
Mm-hmm.
You know what I mean? And I feel like
Yeah.
that's one of the biggest issues of like that part of the industry. It's like, hey, you're liable right away,
Mm-hmm.
and so they
Right.
they take that easy out as soon as they can.
Yep.
Um, he says, I think I'll start an aortic comedy club.
Okay. There's a couple people that'll join you.
Right on. Okay.
All right. But thank you all so much for tuning in today. And you are lucky and you get Molly with you next week. So that's going to be fun and exciting for you guys. Hey, do me a favor before we're done, click like. Make me feel good. Click like, click subscribe, click the bell so you're notified when we go live tomorrow night. I hope you do join us tomorrow night because Dr. Caterino is a lot of fun. He's so super smart. He comes to us from the UK, and we had a really great time the first time we had him on. So I'm really looking forward to this. And click share. You want to share this because somebody will get something out of this, right? And it also helps others find aortic hope so they can start receiving help today. So thank you guys a lot. And I think that's it. That's all I got. Adios, everybody. Have a great rest of your week.